A warm welcome to all our viewers to our series Natural Medicine. Today, Dr. Jordan Petrov's back. He's a doctor, so has medical education, and on the other hand, is also an engineer, and is also the head of the Academy for Science and Research at the University of Rostock. And his speciality is the blood circulation in the human body. And that's something incredibly exciting, and that's why the title of the show is Circulatory Disorders. Welcome, dear Dr. Jordan Petrov. Thank you very much. You're welcome. Now, my first question, sorry, I interrupted you, I am sorry. My first question, because it's practically on the tip of my tongue, the question. I've now made 1,200 episodes, and I've talked to many medical professionals here. The subject of circulatory disorders has never come up. What do you learn in medical school on the subject of blood circulation? You learn a law of how blood flow is managed in the body. But how to improve blood flow, or how blood flow is changing when we age, and how to influence it, not an issue, not an issue. But now I've learned from you that the normal course of a person, that they get older with every day, logically the whole body gets older, and the initially great blood flow decreases over time. That makes us old. That also makes us susceptible to disease. So it's actually not just a modern anti-aging, where you can say that if the blood flow remains high, the risk of illness is lower. Of course. But that's revolutionary. You have to say that. Using the example of the mutation of body cells, we showed the more blood flow, the less mutation. And who has come up with something that can prevent cancer, for example? That's a study that Mrs. Brigitte Koenig did in Germany. Preventative, yes, because that has nothing to do with once the cancer's there. Now it's now being fought. That is another topic again, but now we talk about the blood flow. You can significantly reduce or prevent developing a cancer at all. Of course, due to the increased oxygen supply, because when the oxygen comes into the cell, my metabolism's normal. And if I have too little oxygen in the cell has to survive and starts to ferment. Yes, easy, very easy. Actually, yes. And now this problem of blood circulation and Klinefelds, because that was what I recognised at the time, the potential of these Klinefelds. And that's why I use Klinefelds, the treatment of the liver as a quality of blood. Then I have the heart activity. I document how the heart works. The patients come for liver treatment. I look at them and see, the heart needs to be strengthened. And I have my own recipes for that. Cardiac arrhythmias, sometimes I'm probably the only one who cures this with natural means. So immediately after 3 days, the arrhythmias are gone. Because I go back to the cause, and I'm not striving for final solutions and always for healing. Can you please explain to me again why such Klinefelds work? That I have improved blood circulation and increased oxygen supply in my blood. What happens there? Here I have to expand a bit. In fact, we smell, taste, sour, sweet. We feel pain and feel vibrations. Discomfort comes from the intestines. And why do we notice that? That's the question. There are nerve connections to the brain. Nerve connections. And the nerve connections are specific. So, vibration nerves are responsible for the vibration. We have the nerve endings for pain. We are made of nerves everywhere. So the nerve endings are the pain fibers. We have special nerve fibers for sweet. And towards the brain, whether we see green or blue or red, towards the brain. only nerve impulses run. Electricity only, if you like. We are cyber beings. Incredible. So unbelievable. We work. And the flood of information to the brain is specifically only an electrical impulse. You have to let that melt in your mouth. And now, such an electrical impulse runs over a nerve fibre. The nerve fibre, however, lies on Kleintje fields, and this impulse is influenced. And we know that this influence is going in a positive direction. These nerve impulses are stabilised and come less. If we have a pain, now this stabilisation of the impulse through an action potential, let's say, stabilisation by having a threshold of an action potential formation that is higher, and then fewer impulses are sent to the brain. And when fewer impulses are sent to the brain, then the pain becomes less. So then the bad sensation becomes less. And because of that, that's one effect of the Kleintje fields, that the nerve fibres get a direct influence when they go over alternating polar constant magnetic fields. And that's now, and how does the oxygen get in? So, we talked about the blood itself being activated. When the blood is activated, the blood grabs the substances that have to go out of the tissue. You have to imagine a diabetic whose blood circulation is poor. It's like concrete. Nothing gets through there. And now comes the effect of the Kleintje fields. Everything is loosened up. The blood is activated, and the blood now grabs substances that have lasted for years in the intercellular space and have to get out. And the intercellular space, when it's full of waste products, then it has to oppose a higher resistance to the blood flow. So, our getting old, getting our bad blood circulation, is related to that in old age. Substances accumulate in the intercellular space that do not belong there. They're not inside a young and growing organism. But that works on both sides. On the one hand, with diabetes, footwork is being done to make it better. And on the other hand, I bring a lot more oxygen with me from the lungs. You take a lot more oxygen with you, and now, you know, the thing about the waste products is misunderstood in academic medicine. I once saw a professor on TV myself who said strongly, there are no waste products in the organism. Another professor of dentistry from Munich says mercury is harmless. That only shows one thing, that there are professors who have no idea about practical medicine, nothing else. And there's also a saying that every professor is a bit stupid, and that always shows sometimes not in the right place. The waste products in the body are one of the reasons why we get old. Now, I'll be more specific. There are patients who drink many litres of water, mostly tap water, in order to not get fat. By pumping a lot of water in your stomach, you have less appetite. You eat less, and every pound comes through your mouth. So there you go. This is a really effective measure against obesity. Now, I've had such patients. When I stroke through their skin, small crystals poke my fingers. The skin is full of crystals. And it all happens because the body is usually flooded with too many carbonates, and that has to go somewhere. One part goes through the kidney, and the other is deposited in the skin. And when the skin is full of such crystals, it's thick and not elastic. And when I run the syringe through the skin, it really crunches. No, really? I can't hear it, but I can feel from the syringe that it goes through. And now comes the inexplicable. When the liver treatment is done, the skin becomes thin and elastic. Again, over time, and it no longer crunches. And now I come to a problem, which has become very well, let's say, understood by everyone. There is such a problem of vertebral canal narrowing. Many patients are operated on because the doctor says your spinal canal is narrowed. The spine. That's where the nerve comes through. And this canal seems narrower for the doctor. And then they have to operate with a success that is questionable, because any surgery there makes scar tissue, and one doesn't know what the outcome of the surgery will be in the end. This vertebral canal is also lined with a skin, and if this skin stores such substances as carbonates, then of course this skin also becomes thicker. And the nerve it pulls and moves is starting to hurt, gets inflamed by this stimulus and pain. But I can get rid of that as well. How do I get rid of it? Well, quite simply by fighting the acidity and gradually getting the waste out of the body. And now the Kleinschefels come with the activated blood. Little by little, they will take this waste and discharge it. With that in mind, it's good to talk about uric acid. The body produces uric acid when we obtain energy from protein. Then the uric acid is the rest. And this rest has to go. Uric acid, it's written in the biochemistry book, uric acid is not soluble in water. Uric acid is soluble in a solution of mineral salts. What does that tell you? If I have enough minerals in my body, I dissolve the uric acid. Then I'm basic. Then I'm in the basic milieu. Exactly. If I dissolve the uric acid, it's then dissolved and the kidney discharges it. But that's not enough for the people who keep telling me, oh, Mr. Glog, I don't need that. I drink 3 or 4 litres of mineral water every day. Mineral water means mineral water, and most of it is likely carbonates. And drinking 3 or 4 litres is a risk in itself anyway, because if you boil it, then at the end a deposit will form, which has to be disposed of by the spoonful, and the body has to deal with it, and the kidneys in particular have to deal with it. And then it's stored in the intercellular space, in the connective tissue, Yeah? Got it. And then we come back to the problem of waste formation. Well, that's no use. We're not talking about these minerals. We're really talking about high-quality nutrient intake, which can take over this buffer capacity for this uric acid. So, uric acid, so we have to talk about minerals. So, in old age, that has a lot to do with nutrition, but we have to take nutritional supplements in old age because when we were young, we ate a lot more. What kind of dietary supplements do you take? I mean, I know you keep saying vitamin C, but now this is not a dietary supplement, but it's an antioxidant. We want to be specific now, but we are still in the process of discussing a bit what exactly is happening. So, when we don't eat so much in old age, and if the intestine has become thin, not elastic and wide with age, then it absorbs much less. That means we eat less and we absorb less. But we need the minerals. So we really can't get around the problem if we don't consume additional minerals. And there are different preparations here. I don't want to be specific because then I would... but do you also consume minerals every day? Of course. I take... So, the most important thing is, of course, the food. When I eat mostly green vegetables, but without toxins... Yes, I've just heard about organic quality. The other vegetables are a risk in themselves, so if I consume organic quality, then I have a good chance that I have enough minerals in the first place, enough magnesium. And it's important that I dissolve the uric acid, otherwise it will crystallize in the blood water. The joint only has blood water around it. And if uric acid crystallizes there, now we're getting into osteoarthritis. What do we do? What do we have then? Then we have osteoarthritis. And if we don't respond right away by attaching a strip to the knee on the left and right, magnetic fields, the clencher fields, or just a strip on the foot if the ankle's affected. I had a patient from through a good acquaintance, because he was an acquaintance. I told her, here, I'll give you a strip, put it in, just in the sock, and then we'll see. The pain was gone. But she brought it back after a while, because then I said she had to buy it. She brought it back after a while and says, I don't like it, it bothers me when I walk. And since it was from a good acquaintance, I said, you've worn it for so long now, just take it as a gift. And she kept using it, didn't bother her anymore, and the pain was gone. So, very interesting. Now, I'd like to finish about the blood circulation. Are we already finishing up? Yeah, almost. Yeah, I know, but it was already very exciting. Can you tell me, we also know from research on the clencher fields that the body's own ATP production is increased by 300% at night. Is that simply the connection because more oxygen's coming into the cell from the lungs? Because for me, this is a preventive measure, when by sleeping in the evening, there's so much energy. Alexander. Yeah. If you tell a doctor that, they will say, these are pipe dreams. I'll tell you why. The cell that comes to be examined in this laboratory test is working on a very low level. It produces very little ATP. And if clencher fields now come into play, it will be 3 times more. 300% does not exist, there's only 100%. It will produce 3 times more energy, just through the clencher fields. We have the micronutrients in the mitochondria, We have an alpha-lipoic acid, we have vitamin B12, we have who knows what else. But the Kleinsche fields were enough to activate this production. And the micronutrients were obviously there. So, the cell needed this magnetism, and that is the potential of the Kleinsche fields. And now, if you were normal with your ATP production, and when you're lying on the mattress topper, I can't say from this point you will produce 3 times more ATP. You'll have, let's say, 1.2 times higher ATP production. But the cell that was low in the lab has 300%. No, I'm starting with it too. Did 3 times more. Did 3 times more. And that is incredible potential. So especially with sick people, and then also this one, so especially with sick people, right? The potential there is gigantic. That is with the healthy and the sick. And I prefer to treat, now you'll laugh now, healthy patients. Yeah, logical, I understand that. Now, one more thing, a very wise doctor who once sat there, where you sit now, once told me, the sun sends us electromagnetic rays, and the Earth protects itself from it with a magnetic field. Do you know the gentleman who said that? A constant magnetic field. That was you, by the way. And then we talked about electric smog, and then we also said how people can protect themselves in bed against the electromagnetic rays. And we came back again to the constant magnetic fields. That's why it's the Kleinsche fields again. That's right. So the Kleinsche fields have constant magnets, and the magnets protect against the electrical radiation that we've talked about before. And these electric rays, the electromagnetic rays, they can't get through there. But in the end, they would create rouleau formations in my blood, a lack of oxygen supply, and the Kleinsche fields open them up again. And the electromagnetic waves can't get in. It's a give and take, everything in balance. And this is exactly the balance I'm talking about when it's about that. There's always a balance in the intercellular space. We'll have to talk about poisoning and detoxification. Let's do it, but let's finish this episode first. And I think with the introduction of the ever-increasing digitization of the world, where 5G is also an issue, isn't it almost compulsory that we somehow protect ourselves with the Kleinsche fields, at least at night, from this attack of electromagnetic rays? You can't call it compulsory, but it will definitely be qualified as an act of reason, because as long as I have no complaints, and when do I have no complaints? Take me, for example. My blood pressure, without medication, I don't take any, is 125/80. Then I automatically know my vessels are elastic and not closed. No arteriosclerosis, otherwise it wouldn't be 125/80. And if I tell you an example now, when my son was young, a toddler, we didn't have much of this electric smog. But now a relative of mine has a child that at 6 months or so, every time they go with a sleeping child past the checkout in the supermarket, the child startles and wakes up and screams. The children always notice this radiation at the checkout. Parents can see that very well. When the kids are asleep at the checkout, they react immediately. And also, I went to a lawyer's apartment. Educated people, modern, smart. Here, in this corner, is the Wi-Fi router. There's the wall. Behind the wall is the bed of their 3-year-old daughter. And the head is right next to the router. Great, and then maybe also a baby monitor in there. It's unbelievable. It is unbelievable how much education the population actually needs. And I'm happy that we can effectively remove something from this mountain with our discussions. Because I have a beautiful book by an author I know personally. He thought he solved the problem in his apartment, but the problem was not solved and he then died later. But he wrote, when 1,000 doctors get together and write a proclamation against the fields, then 1,000 come together again at the other end, and they will write that it's harmless. Therefore, the responsibility of the individual is required here. We must realize that this radiation is inevitable because it's related to modern life and it's associated with progress. But we have to deal with it sensibly and protect ourselves from it. I got it. Thank you very much, dear Jordan. But one thing we can really do are these preventive blood flow optimization measures with these Kleinsche fields. But what we also have is protection against electric smog, 5G. No matter how big the thing gets, we would at least have protection during the night, which really works. And oxygen transport is guaranteed. Well, I'd like to leave it at that for today. And in case you agree and say that I have summarized it correctly, well, we've seen several summaries up to now. But I do think that was correct. All the best to you, dear Jordan, and to you, dear viewers. Of course, we will continue with more episodes while Dr. Jordan Petrow is already here. Then I just have to milk him like a cow to get more information. That was very well said. I don't mind at all. All right, all the best and see you next time.